I just realized that my microphone was not on. Recording here on Facebook. I know Instagram can hear me, but Facebook couldn't hear me. Okay, so we're live. My name is Nicole Alfred. I am a registered massage therapist. I've been in practice for 15 years, and I have a special focus in working with patients when they're pregnant, through their birth, and also in postpartum. And I've taken a special interest in working with patients who have gone through cesarean delivery. So they've had a C-section, and helping them to recover and prepare as well for planned cesareans. Specifically with recovery, it's all about the scar work. So if you've watched any of my past videos, you'll see that that's what I love to talk about, because I don't feel like there's enough information about postpartum recovery when it comes to cesarean. But today we're going to be talking about preparing for a cesarean. My family and I are preparing for our second baby to come in March, and she's going to be born via cesarean, planned cesarean. And so putting this list together kind of helped me, but also I thought could be useful to help others. So the first topic that we're going to be talking about today, where are we here? Okay. So what's in your bag? So I have my bag here. I am 32 weeks pregnant. Some people thought it was a little excessive that I had already packed my hospital bag, but I didn't think it was at all, because you never know. Anything could happen. And the last thing I'd want to do is have my husband freaking out last minute trying to pack things for me and probably not bring the right things. And while I'm recovering from an emergency cesarean. So hopefully everything goes as planned, but you just never know. So you are welcome to download my Ultimate Hospital bag checklist for cesareans. It's linked on the Facebook page here, and I will send it in my stories. I'll put a link in my stories there. And it's also on Instagram. It's in on my links on my profile. If you go to the link there, you'll see it says the Ultimate Hospital Bag Checklist for cesareans. Okay, so I'm going to kind of go over it right now with you guys and show you what I have packed in mine. And if you have any tips or tricks that you want to share as far as preparing for your cesarean and what to pack and that sort of thing, things you thought you needed that you didn't, or things you wish you brought that you thought was going to be there. Every hospital is so different, and especially if you're watching this in the US or across the world. We're in Canada, so in Ontario, so this is kind of based off of what we currently have here for our patients. So mom's cesarean birth hospital bag checklist. So pen and notebook. My pen and notebook are right here. So I was just actually writing in it today. I have my notebook and my pen. So that's in my bag. What else do we have? Folder, large envelope, or Ziploc bag for important documents. Okay, I don't have that yet. I do need to pack that. ID card, insurance card, health card, credit card. That's actually my wallet, which I'll be bringing. So something that you've noticed probably a lot with postpartum women is we like to wear adult diapers. No, I'm just kidding. We don't actually like to wear adult diapers. It's just what is easier after having a baby when you have all that stuff coming out of your body, which is called lochia. And it's almost like you're on your period, but more. And especially after a cesarean, it's just easier to be able to have something that's not restrictive around your lower abdomen. Some of my friends have used men's boxer shorts, their husband's boxer shorts. That works too. But like an adult diaper, mesh underwear, or like a really thick pad with like really high-waisted granny panties is what we call them, would be sufficient as well. So I have those packed. There's one right here. This is actually from when I had my son a couple of years ago. So I have to buy more. I think I only have 2, because you just never know. Slippers, flip-flops, warm fuzzy socks. So got the warm socks in here. I have 2 pairs, and I just bought a pair of flip-flops the other day from Old Navy because I couldn't find mine. All of my summer stuff is packed away, and it's winter right now. So What else? House coat, nightgown, if you prefer over hospital gown. So some people don't want to bring their own clothing into the hospital, and that's totally fine, but others want to feel comfortable. Usually with a cesarean, you're there for at least 2 days, sometimes longer, depending if there were some complications with mom or baby. So just be prepared to stay there for at least 2 nights. So I have this like super comfy sweater I've actually never worn. I just got it again from Old Navy. And it's like really long and really warm. Hospitals can run a little cool. And especially because you would have just had surgery. You may feel a little cool. So you definitely want to have a nice warm sweater. And then I have a nightgown. Nothing special. It's just like a long black nightgown. You can have something that you wear kind of in your room if you're getting a private room, or if you don't really care who sees you. And then if you want to have something like a house coat that you put over you, or like a big sweater like this, because you will be walking the hallways a bit after delivery, because the more you get up and move, the better for digestion to start again and to get the gas out of your body, and just for recovery. So you definitely want to know that you are going to be moving around. So I have my flip-flops here. These are mainly for when I take the shower or when I'm walking around the room, but I also I'm going to be bringing home my Birkenstocks that I have. They're kind of like a clog Birkenstocks. So if you want to bring like slip-on shoes or like a closed-toe shoe you can wear with your socks to be able to help you walk around the hallways, that would be great too. Abdominal wrap system. So my abdominal wrap system of choice, which I have not used yet because they came out just after I had my son, so I didn't get to use it. And then when I took one of their courses, I actually won this. I was going to buy it anyways because I do promote it to my patients, but it's the Bellies Inc. ab system, ab tank. And basically the whole point of this is to help give you that external support as you're healing internally. So it comes with like a little booklet of things you can do. I'm just going to see if there's a picture on here of someone wearing it. Nope, there's not. This is, oh, here at the back. You can see there's like a wrap and then there's a tank that you can wear too. I'm not sure if I'm going to wear both. I'm going to try them on first and just see kind of how it feels. But this is like a tensor bandage material, and it's just meant to give you some of that support on the outside. I know after I had my son, I really liked having like that spandexy tight support tank on because you kind of feel like everything's going to fall out of you, to be graphic. Okay, what else do we have? Toiletries. So I have my whole toiletry bag here. Dry shampoo. I don't think I have it in here yet. But because I'm having a planned cesarean, I'm getting my hair done the day before. Yep, getting my hair done the day before my planned cesarean. I want to look nice. Why not, right? So I'm taking full advantage of the fact that it's planned and I get to look pretty for my pictures instead of like I just got hit by a truck like my last one. So the kind of stuff that I have in here is like my contact lenses. I'm going to be putting my glasses in. I wear them every day, so I haven't put them in yet. Definitely like a lip balm. I have my son's little lip balm he gave me for the hospital. But I also have one that's like a really healing lip balm to help because it can be a little dry in the hospitals. Nail file, just in case I need to file my nails. Deodorant. I don't plan on having visitors other than just my son and who's bringing him, which is my dad and my stepmom, and then my husband. So really, who cares if I stink? But I probably want to smell good. So I'm bringing deodorant anyways, just so I can feel more like myself. And I do plan on taking a shower at some point there. So, you know, having a little loofah with your body wash and all that stuff, toothbrush. I actually have packed some of my favorites. Oh, toothbrush. We got toothbrush here. Favorite face cream, which is from a company called Iliki. I don't know how you even say it. It's an organic skincare company. And this sour cherry. Oh my God, I love this stuff. It really smells like cherry. And it's, I don't normally like cherry, but it just has such a nice fresh smell to it. And when I put it on, I feel so good. And I thought, why not do something for myself while I'm recovering from surgery and just having this new brand new baby in the hospital? Something that's going to remind me of home. And that makes me feel so good when I breathe it in. So if you have like a light spray, not a perfume, but like a light body spray or a cream, a hand cream that you like to put on when you smell it, just smells so good. Bring stuff like that. Hello to everyone who's joined recently. I'm just going through our hospital bag that I have packed, sort of packed, and also the checklist that I have that you can download. If you have any questions or tips you want to share what you packed, please feel free to do that. And let me know what worked for you, what didn't. What else do I have in here? Small pillow to brace your incision. So I don't have that packed yet because it is something we can just kind of quickly grab and go. The whole point is having a small pillow is you put it over your incision if you have to cough or sneeze, when you're in the car, like the car ride home can sometimes, like all those bumps can really, really be sore on your belly. You can also just use a regular pillow if you want to bring your own pillow at the hospital. That's definitely fine too. You can just use that. Eye mask and earplugs to help you sleep. So I don't have that packed yet. I actually don't even have an eye mask, but my husband does, so I'm going to steal his. And earplugs. I don't know. I'm going to bring headphones. So if I'm end up being in a room where I have to share with somebody else and their baby is crying, like last time we were in the hospital, their baby was crying all night, I may just put on some like relaxation music and just try to sleep that way. Music. You can listen to this while you're waiting for birth. I also downloaded, I can share the link on here and to you guys. I downloaded the Mindful Cesarean, like probably last year, just to kind of see what she included in her program. And it was actually really great. I've been doing it to prepare me for the cesarean. And basically it's just like it's a PDF of like, information. And then she's made all that information into kind of meditation audio recordings. And, you listen to them at different points while you're preparing for birth. And she really like compares different stages of you going into your cesarean delivery and having your cesarean delivery. And she compares that to when you're actually in labor and preparing for a vaginal delivery. So it helps like, okay, this is a part of transition or this is part of pushing, and really helps you to kind of connect that way to what you're going through with the cesarean delivery to make it feel more intimate and more like birth and not just surgery, because it really is birth, right? So anyways, so I'm going to probably listen to that while I'm waiting. Hopefully we don't get bumped. Apparently, even if you have your appointment first thing in the morning for your delivery, you can get bumped. So we're going to have to bring some stuff to keep us busy. And so that our nerves don't get the best of us. Camera, phone, headphones. Okay, so I don't know if we're going to bring our camera. It's pretty bulky. It has its own bag. It's just like one more thing you got to look after. So we may just use our phones because, if you have the newest iPhone, you have a great camera already, right? Special foods or drinks you like to eat in postpartum. It's definitely more high fiber foods. So I haven't packed those yet. I don't know what I'm going to bring. Really just depends on what I'm feeling like when I pack it, because with pregnancy, you have different cravings, right? But definitely something that's going to be high fiber. Chewing gum, I have that packed already. This is to help you restart your bowels. So I've read a study online and just read some information online as well about chewing gum. So basically when you chew gum, your enzymes of your stomach start to come like they're going to be digesting food, right? Like your brain receives you chewing gum like you're chewing food. And so that can start kind of the whole chain of digestion. And so one of the big things with cesarean is that your internal, or like your large intestine, it's a smooth muscle. It can sometimes get a little lazy or asleep during surgery because of the medications. And the idea is that you want it to start kind of moving things through gas and maybe even be able to have your first poop before you leave the hospital. Because if you can't do that yet, they won't let you leave. So this article I read was suggested to start chewing gum as soon as you come out into recovery. So I have that. I have, I think it's like a mint gum, or which one is it's either mint or cinnamon. I don't know. What else do we have? Reusable water bottle, no straw. So I have my reusable water bottle here. I just fill it all the time. No straw, because straws can cause gas, and you do not want to drink anything bubbly or use straws that will be increasing gas. So that will be being brought. Charging cables for electronic devices. And something that I read once before, which made so much sense, is to order your pain meds before you leave the hospital so you don't have to wait in the pharmacy. So if you're being given some pain meds that are like considered narcotics, your partner can't pick them up. You have to be the one to pick them up. So that's what happened last time, at least for me. And so I remember leaving the hospital being like, I don't know if I want to take them because they sound pretty intense. I think it was like oxys. But I also was in a lot of pain. I didn't want to not have them and then have to go back out again. So on our way home from the hospital, my husband stopped by the Shoppers Drug Mart, and I walked in so much pain. I could barely stand because I had a bit of trauma during my delivery and lost a lot of blood. So I could barely stand. And I'm like literally like kind of just moving along to get to the pharmacist, and then you have to wait. So I noticed that the hospital we're giving birth at has a pharmacy in there. So the best case scenario is that we even just do it there at the hospital and get the prescription filled there. Okay, so any questions so far, comments about what you're packing in your hospital bag? Anyone have experiences of maybe they brought too much, they didn't bring enough? Did you have an emergency cesarean that you wish you had stuff with you? I know that was me last time. Anyone have any comments for that? Just post. Okay, so the next one is packing for baby. So what is in the baby's bag? Now, I did pack too much. And I keep going in every couple of days and taking things out and putting new things in because, you just get a little obsessed waiting for this baby to come, and it's exciting. So I think I showed my new diaper bag. It's a Skip Hop bag. It's vegan leather and it's a backpack. Isn't that smart? My last bag was not a backpack. This is really smart. It makes more sense because then when you have a baby that turns into a toddler, you just put it on and you can walk with it. It's a lot easier. Okay, so packing your baby's your baby bag. Okay, so let me just pull that up quickly here. Here we go. Okay. So onesie that is opened at the bottom. So I have a few of these. Just open my bag. It is so packed. Oh my God. I'm probably gonna have to take some of this stuff out. My husband will think I'm crazy. Okay, so she's supposed to be a little big. I have some newborn stuff, but not a lot. So this is newborn, but I may bring a 3-month one just in case, but I'm sure she'll fit in this for a day or two. I'm sure she'll be fine. So when I'm saying onesie that is open at the bottom, what I'm talking about is it doesn't have those buckles or zippers or anything. And the great thing about these with newborn babies is in the middle of the night, because this is what I experienced, not in the hospital, but at home, in the middle of the night when they poop or pee and they need to be changed and it's like 3 a.m. and you're like totally exhausted, all you do is you just roll it up their body, change their diaper and pull it back down. You're not at 2 a.m. trying to button these little button things, and in the morning you wake up and it's all over the place and not even done up properly. So I love these. These are essential. If you have someone having a baby that you know, buy them some of these. These are great. So I have 2 of those because, babies spit up on things. This is the color of the other one. It's cute. My mom bought me them. A going home outfit. So this one has changed a few times because I just got this one and it is so cute. Okay. This is our going home outfit. And I don't think I'm going to change this again. And then it comes with this cute little hat. Look at this. Oh my gosh. Right? So that's her going home outfit. She's going to look pretty fancy. My husband, again, is going to think I'm crazy, but it's okay. A warm hat and mittens. So I have a million of these hats because my grandmother was like on a sewing frenzy or a knitting frenzy back in the day. Whoopsie. And she knit me so many of these hats. Where are they? Okay, I can't find them right now. I'll find them in a minute. Anyways, all these little hats. So she knit me all these hats. Why? It's in here somewhere. Oh my God, this thing is like so overpacked. Don't mind me. I'm just looking for. Oh, I bet you it's in this one. There's so many pockets. I'm not used to this thing yet. Sorry, guys. Okay. So we have our little hats. See these little hats? My grandmother knit these for us when I had my son, but I had literally had like 20 of them. And then we have like our little mitts, which I don't know if I agree with mitts. I've heard like very opposing ideas on this, that like it stops them from being able to sense their own face. I don't know, but we'll see if she has long nails, and I don't know. I bring them just in case. Okay. So if you like the mitts, you got the mitts. If not, just don't use them. Okay. So there's that. Baby nail file clippers. So I have my nail file in my bag. I didn't show you guys, but it's in there. Newborn diapers. So this is a pack I got when I signed up at like Time or something. It was a free little pack. I thought 20 diapers. Can't go through that many in 2 days, but so we have these. If I may pack a bigger size just in case, but depending on how big they think she's going to be. A baby book. Oh, sorry. Small dirty laundry bag to be able to sort out your stuff when you get home. So if you have like another extra little laundry bag, you can put some of the dirty things in. So then when you get home, you just throw it in there. You don't have to worry about sorting. I don't think I have that because I was looking. I have a bag and I couldn't find it. So that's one thing I need to add. I don't know if I have room though, but we'll see. What else do we have? Baby face cloth. I just bought some, so I'm going to add those in here. Burp cloths and receiving blankets. They should have face cloths at the actual hospital if you want to use them. I'm planning on not having our daughter bathed at the hospital because you hear so much good reasons why that vernix, which is that creamy substance when they come out, should stay on them for as long as possible. So I'm planning on not having her wash. So I don't even know if I'm going to need a washcloth for her. I do have baby wipes. So I have like my little change bag already put together. And we have baby wipes in there, the change pad. I have these little diaper bags for, it's like the doggy poop bags from the dollar store. Again, I got this free, this baby wipe package from, I think Time. It came in a little package for me. So that's all ready to go there. I have some of those muslin blankets that she can be swaddled in if she wants to be swaddled. I do have some receiving blankets in case she needs that. I also did pack like a little sleep sack. And it also swaddles too, just in case we try swaddling and we're like, oh, I have no idea what I'm doing. We'll just do that. Oh, and I have another muslin blanket. I probably don't need all these blankets, but I'm doing it anyways because I just am. Breastfeeding pillow to keep your baby off your incision. So I actually used to have a breastfeeding pillow. I don't think I'm going to buy a new one. I don't know where my old one is because it's been 5 years. I don't think I'm going to buy a new one because I'm starting to read a lot about how maybe they're not that great. But you do want to at least have some kind of pillow to put over your incision so that baby's not sitting right on it. But if you do have a breastfeeding pillow you want to use, go ahead. I also have all of these, oh my God, what's the word? Breastfeeding pads to put inside my bra when I if I choose to breastfeed, and I am hoping to breastfeed, but if I do end up getting my milk in while I'm at the hospital, likeliness of it coming in, I don't know, but we'll see. I keep them there just for emergency. And this is just stuff I already had in my bag for when she gets bigger. It's just like a little music thing and then an ear thermometer. So those are kind of like already in there. I do have extra like pads for me just in case. So those are in there. I don't have nipple cream because usually those first 2 days, you may not have any issues with your nipples, but if you do, it's good to just have one already bought in your bag just in case you do need it. I am bringing my breast pump and all the stuff that comes with it. It is in the other room. I didn't bring it in here, but it's already sterilized and ready to go. I just picked this up today. It's a silicone breast pump. It's the Haka. I don't know if you guys have ever heard of this before. And basically, it just kind of like you squeeze the bottom and you stick it to your breast, and then it just kind of helps suction out the letdown. If you're feeding on one side, you put it on the other. So probably not going to bring this because I don't expect that much milk to be in at 2 days. But I do have that for at home. If you're planning on not nursing or you're not sure if you'll be able to, you want to bring some formula, distilled water, something to clean out your bottles, and your sterilized bottles and nipples. If you are just wanting to use the pre-made stuff, it's easy. You just kind of like open up the package. The bottles are in there, the pre-made formulas. I think it's the same stuff they have at the hospital, and you can use that as well. If you are planning to do that route and not breastfeed, you may get some breast engorgement. So you may want to look at bringing some like cold compress, like an ice pack or something to help put on your breast, or even a heat pack, whatever is going to feel better for you, just in case you're sore. A newborn pacifiers I do have. I don't know if I'm going to use right away. This one is by the First Years. There's also the Philips one, Philips Advent Soothe. You just want to make sure that the actual like nipple of the soother is very long, because it's supposed to imitate your nipple if you are planning to breastfeed. You don't want to have that nipple confusion. And last but not least is your partner's bag, which is a lot smaller than yours for the given reasons. Okay, so what's in your partner's bag? So obviously they're going to bring their own toiletries. Sometimes some hospitals give you a little pillow, a little blanket. They can use a blanket, but otherwise if they want to bring their own. Some hospitals that are older may not have great chairs. Like some chairs are great. They actually can lounge back. Some of them that aren't that great, you may want to make sure they bring something so they can be comfortable in the room. Phone, headphones, charging cables, ID, insurance card, health card, credit card, change for a vending machine. Most hospitals have great food courts nowadays, so I don't know if you really need change depending on how old your hospital is. Comfortable clothes, I would say at least 2 to 3 outfits. Sometimes babies can make a little bit of a mess, pee on you, whatever. So you just want to be able to have some extra change of clothes for yourself. Bring an iPad, playing cards, anything you guys like to do together to pass time. Definitely have like the contact list ready to go on their phone of who they're going to call and share the big news with. If they have to call long distance, calling cards, that sort of thing. And also to have the installed car seat base in the car. That is what's really important. If it's not in, at least have it purchased and like kind of with the car, and then they can always go down to the parking garage and install it themselves. They're usually pretty easy to install. I know with our first, we went to the whole like car seat clinic and everything because we were worried that we weren't doing it properly. But if you go on YouTube for your car seat and you can see how to properly install the bases, then you should be good to go. Don't worry about it not being installed. And then last but not least, I wanted to also bring up the bringing your car seat in your stroller. So the hospitals won't let you leave unless you actually have a car seat that's, you know, not expired and it's safe and the baby's tied in properly. They usually actually check the baby before you leave the hospital. So you want to already have that purchase. You could bring it in the box in your car. Like it doesn't have to be all set up, but you definitely want to have that purchased and ready to go. And also your stroller, because when we gave birth the first time, it was a smaller hospital. It was an older hospital. And literally you would park and walk not even 5 minutes and you were in the maternity suite. So to get from the maternity suite to the car was very close, and to be able to hold the car seat was super easy. But now they've closed that hospital down and made a bigger hospital, and the parking garage is like on the opposite side of the hospital than the actual maternity suite. So it doesn't make sense for us to be carrying the car seat, carrying all of our bags. I mean, I'm most likely not going to be carrying our bags. I may even be in a wheelchair. So, you may want, it's because it's quite a far walk for our hospital in Oakville. So you may want to have like your stroller. That way you can throw some of your bags in there, attach your bags to your stroller. Like this diaper bag I was showing you attaches to my stroller. And then that way you can have someone pushing you and the other person pushing the stroller, or whatever makes sense. I mean, of course your partner can always bring all the bags down first, and then you can just carry the car seat on your lap if you're not walking. But I thought, like strollers are great for being able to help transport more than just the baby. So our stroller is all ready to go, and he's going to be putting that in the car as well. So that's that. Oh, one more thing I didn't show you and is not on the list. If you are shy and you don't like to bring out your breast if you're planning to breastfeed, they have a lot of these like really cool breastfeeding covers that you just kind of put on and you can hide baby underneath to breastfeed. I also used a lot of my muslin blankets, and I kind of would just attach it to my bra and let it drape over me, and I would cover that way. But I mean, you're going to be in the hospital. The nurses are going to want to see make sure that you're breastfeeding properly. But if you do have people visiting the room and that sort of thing, and you want to cover up when they're there, especially like if it's your dad, that's kind of weird, So I would definitely probably cover up when my dad comes. But yeah, so it's kind of the things that I have packed and ready to go and that are on this list. You can get the link through Instagram on the link tree in my profile. It's called the Ultimate Hospital Bag Checklist for Cesareans. And here on Facebook, I've linked it as well in the title here. You can also join us in our cesarean support group on Facebook. It's called C-Section Moms Plan, Support, Recover. I share ideas like this. We have chats, we talk, people share experiences, share stories. It's a really great supportive group of women all over the world, really. And so we have about 500 members right now. And it's really interesting to see kind of how it doesn't matter where you come from in the world, that we're all kind of going through the same things when it comes to cesarean and planning for baby and recovering, and not having that information we need to recover properly. So join us over there. Again, that link on Instagram for that Facebook group is also in the link tree. And I will see you guys next week because we are live every week. I know it's Thursday. Usually we're live Tuesdays, but we had a strike day here in Ontario, so didn't want to do any live while my kid was home, unfortunately. So, okay. I hope you all have a great rest of the week, and I will see you next week. Take care, everyone.